Is AI going to replace your doctor? This is a question that causes fear in patients and searching for answers. People imagine a cold, robotic arm performing surgery or an algorithm diagnosing you through a screen. It sounds like science fiction. But the real science fiction story isn't about replacing doctors. It's about building a better one. Imagine a tiny sensor on your wrist that doesn't just track your steps, but alerts your doctor to a subtle change in your heart rhythm days before you'd ever feel a symptom. That's not the future. That's now. Artificial intelligence is here, and it's becoming the most powerful tool in our medical toolkit. Today, we're going to pull back the curtain and show you how AI is creating a new era of proactive, personalized healthcare, not by removing the human touch, but by supercharging it. From reactive to predictive, AI in early detection. For the last century, medicine has been reactive. We waited for you to get sick, show a symptom, or for a disease to grow large enough to see on a scan. That's like waiting for the check engine light to come on in your car. The damage is already starting. AI completely flips that model. It's a pattern recognition machine on a scale the human brain can't match. We already see AI-driven systems that are more accurate than human radiologists at detecting the earliest signs of breast cancer. Google's DeepMind AI can spot over 50 different eye diseases from a single retinal scan. But here at Palm Health, we believe the real magic isn't just finding disease earlier, it's predicting it before it even forms. Our AI platform doesn't just look at a single lab result. It analyzes the trends in your data over years. It can see a subtle, persistent rise in your inflammatory markers or a slow decline in your kidney function and flag it as a risk, years before it would ever show up as abnormal on a standard test. This is the difference between finding smoke and preventing the fire. Goodbye. One size fits all. Hello, personalized medicine. The old way of medicine treats you based on averages. The guidelines for blood pressure or cholesterol were created from studies of thousands of people. But you are not an average. Your unique genetics, lifestyle, and environment determine how you respond to everything. AI is the key that unlocks true personalization. Take a 45-year-old professional here in Jacksonville. They're trying to optimize their health. The old way? We'd give them a generic handout on diet and exercise. The Palm Health way? We equip them with a continuous glucose monitor. Our AI analyzes how their body responds to every single meal in real time. It might discover that a healthy banana spikes their blood sugar more than a piece of dark chocolate does. The AI finds the hidden triggers in their diet that are unique to their biology. We then use that data to build a nutrition plan that is 100% personalized. That's the power of AI. It turns your body's data into a personalized instruction manual for optimal health. Now, I want to talk about one of the most important and, frankly, scariest topics in medicine: medical errors. There's a staggering statistic that everyone should know. A landmark study from Johns Hopkins estimated that if medical errors were officially tracked as a cause of death by the CDC, they would be the third leading cause of death in the United States, right behind heart disease and cancer. We're talking about over 250,000 lives lost every single year. This doesn't happen because doctors are bad people or aren't trying their best. It happens because the system is incredibly complex. Doctors and nurses are overworked, and humans, no matter how brilliant or dedicated, have cognitive limits. A single patient can have dozens of lab results, multiple medications, and a complex history. It's a recipe for things slipping through the cracks. This is where AI becomes an essential safety net. Imagine an AI co-pilot that, when I prescribe a new medication, instantly cross-references your entire medical history, your genetics, and all your other prescriptions in a fraction of a second. It can flag a potentially dangerous interaction that even the most careful pharmacist might miss. It acts as a tireless second opinion on every scan and lab result, flagging subtle abnormalities that the tired human eye might overlook at the end of a 12-hour shift. In hospitals, AI can even predict which patients are at the highest risk for developing life-threatening conditions like sepsis, allowing medical teams to intervene hours or even days earlier. Your wearable isn't a toy, it's a data powerhouse. Millions of us are walking around with powerful medical sensors on our wrists and fingers. But for most people, that data just sits in an app. It's a river of information with no one to interpret it. It's noise. Our approach is to turn that noise into a clear signal. As a DPC practice, we have the time to actually integrate this data. Our platform connects to your Apple Watch, your Aura Ring, your Fitbit. It's not just about seeing your heart rate. It's about the AI analyzing your heart rate variability, HRV patterns, to measure your stress and recovery. It's about seeing a dip in your blood oxygen levels during sleep and proactively screening you for sleep apnea. Your old doctor has no time to look at your sleep data. We've built a system that puts it at the center of your care. The AI does the heavy lifting, analyzing thousands of data points, and alerts us, your human doctor, to the trends that matter. It allows us to ask better questions and catch problems when they are small. The big question: will AI replace your doctor? This brings us back to the big question. And the answer is an emphatic no. AI is brilliant at tasks, scanning images, analyzing data, recognizing patterns, but it cannot replicate the most critical elements of medicine: empathy, intuition, and the human relationship. AI can tell me that your heart rate is elevated, but it can't understand why. It doesn't know you're going through a stressful divorce or caring for an aging parent. Think of AI as the world's best co-pilot. It's monitoring all the systems, running the diagnostics, and alerting me to potential dangers so I can focus on the most important thing: you. The future of healthcare isn't man versus machine. It's the doctor, empowered by the machine, to give you a level of care that was never before possible. The future is already here. The applications are exploding. AI is accelerating the discovery of new drugs, making cures for rare diseases possible. It's powering virtual health assistants that provide 24/7 support for chronic conditions. In hospitals, it's making surgery more precise and reducing wait times. But you don't have to wait for this future. The principles of using data to drive proactive, personalized care are already here. It's about having a doctor who is as fluent in technology and data as they are in medicine. It's about building a relationship where your whole life, including the data from your wearables, is part of the picture. AI is not here to replace the human side of medicine. It's here to save it. By taking over the data-heavy, repetitive tasks, it frees us doctors to do what we were meant to do: listen, connect, and heal. This isn't a far-off dream. It's the model we're building every day at Palm Health. We're combining the best of high-tech with the power of high-touch. If you're ready to experience a smarter, more personalized, and more human-centered approach to your health, click the link in the description to learn more. Welcome to the future of medicine.